As president of the National Association of Pediatric Nurse Practitioners and as a national leader in pediatric nursing education and policy, I feel compelled to speak out against the ongoing actions of the Secretary of the Department of Health and Human Services, which are frankly creating chaos in our nation's public health system. In less than 7 months, the Secretary has attempted to undermine 60 years of rigorous research and scientific analysis that's been conducted by thousands of dedicated staff and volunteers who work for the Center for Disease Control and Prevention and its Advisory Committee on Immunization Practices, also known as ACIP. He has repeatedly spread and endorsed misinformation to undermine the public's trust in vaccines, which are the #1 preventive healthcare measures to protect our children and families from infectious diseases. Because federal officials are now choosing to disregard more than 200 years of evidence that demonstrate that vaccines have saved millions of lives and that they've significantly reduced healthcare costs by preventing severe illness and infection, it falls to pediatric advanced practice nurses, pediatricians, and our fellow pediatric providers to champion one of the most fundamental truths of pediatric healthcare, and that is that vaccines save lives. After thoughtful consideration, NAPNAP's executive board has determined that our association cannot support the questionable recommendations of the current ACIP voting members. NAPNAP supports all evidence-based information that leads to having every infant, child, and adolescent, and also adults receive all age-appropriate immunizations on time. Therefore, we voted to endorse the American Academy of Pediatrics' recommended child and adolescent immunization schedule that was published on August 19, 2025. And we urge our members to recommend immunizations and counsel patients and families based on the AAP schedule. As the most trusted profession in the U.S. for 23 consecutive years, we must serve as the trusted factual source to answer questions and provide evidence-based guidance. Thank you.